Hi, I'm Dr. Nick Curtis. I am a golf rehab and performance specialist here in Brentwood, Tennessee. And today we are talking about TPI, or Titleist Performance Institute's lower quarter rotation test. And we're going to talk a little bit about the test, what impact that has on the kinematic sequence, or what the kinematic sequence is, and how we can go about integrating rehab and performance exercise and training to improve our lower quarter rotation test to hence improve our kinematic sequence and golf performance. So to do that, what we need is to understand a little bit more about what the kinematic sequence actually is. Um, when it comes to the golf swing or really any rotational sport, we need to understand the sequence of events that needs to happen for most efficient swing, right? So in the golf swing, as we come into the backswing, we're going to be talking about that transition from the backswing into the downswing. There's a few key things that happen in all the best golfers and most proficient golfers in the world. Even though their swings can look drastically different at certain aspects, there are a few things that are, we can say, permeate all golf swings, all efficient golf swings at least. And that is the order of events from the backswing to the downswing, the initiation of a few of these events. So the first thing when we go into our backswing is that we expect to see that the pelvis begins to move first. So what that means is that this pelvis goes from a negative trajectory, so backwards, and starts to move. First of all, it slows down first, and it starts to move in the positive direction or forward before the trunk. In fact, the pelvis will start moving forward as the trunk is still moving backwards. It's slight, but it's there. Then we get a kind of slingshot, or we get this stretch shortening cycle that creates a slingshot for the trunk to come around. And the trunk will start moving forward before the shoulder even starts moving forward. In fact, the shoulder is usually still moving a little bit backwards by the time the trunk is starting to move forward again. And then that creates that stretch shortening cycle for the shoulder and the arm to come around, which then leads to the club. So the club is last. It creates another little stretch shortening cycle here at the shoulder complex to allow that club to be, and the arm to be slingshotted down through and into impact. So again, there's a lot of different components to the golf swing, but one thing that we do want to see is the ability to create that kinematic sequence. Now, a lot of times people's issue is not just understanding the kinematic sequence of what needs to happen first, and not even understanding what muscles need to work or what that kind of feels like to do that kinematic sequence, but another step further where they simply have mobility restrictions that are keeping them from being able to do something like that. So we go back into motor control and mobility issues, say they don't have the mobility to create a ton of hip or pelvic rotation. If they can't do that, it's the same thing as doing it from a neutral position. If they can't do this from a neutral position, then they can't do it from here either, which means it's impossible for them to separate the pelvis from the trunk. These two things want to work as one. So we need to have just the mobility at the hips and pelvis to do this. And then we have to think, well, do they have the strength in the thorax to be able to resist or create a stable position here for the pelvis to move on top of? Beyond that, we need to know, do we have adequate trunk rotation, that it's maybe not the hips that are restricted, but the T-spine. If we can't move the T-spine on a stable pelvis, we can't create separation. We can't have an effective kinematic sequence. The same thing goes up the chain. So that's the kinematic sequence. And how does the lower quarter rotation test help tell us more about a golfer's ability to have an efficient kinematic sequence? Well, the lower quarter rotation test looks specifically at kind of the pelvis down. It wants to know, do we have enough mobility in a standing position for adequate golf range of motion in the backswing and the downswing? So there's a few different ways that we look at this. One, we are looking at the backswing and the downswing. For this one, I'm just have it set up for the backswing. I'm a righty golfer, so this would be backswing position. We simply just repeat the test on the downswing side. So for the backswing, we're standing up on one foot. I'm going to choose my backside hip to start. I have full foot contact on the ground. I stand up, straighten my knee completely. From this position here, I got all my weight on my front foot. I'm going to rotate around my pelvis towards this 60-degree angle. So I've created a 60-degree angle here using a goniometer, and I've just lengthened that with these PVC pipes for you to see. So I stand up nice and tall. I rotate towards the side, and I'm looking not at chest, but belt line. Again, this is lower quarter. So I want to know, does my belt line of my pelvis pass that 60-degree angle? If it does, then I can be pretty confident that from pelvis down, I have enough mobility in this instance of internal rotation that I can get into an efficient backswing position, at least with these joints here. Now I need to know if this lead side leg has enough external rotation at the hip, pelvis, knee, tibia, and ankle to get me into this position. I need to get to 60 degrees. So standing up nice and tall, I rotate out, look at that belt line again, not what the trunk is doing, to see if I break that plane. As you can see here, this plane of my belt line is definitely not getting to 60 degrees. But if I keep going, I start to match that plane of 60 degrees with my belt line. That means that I should have adequate range of motion there at that lower half, really. Okay. Now we'd simply flip this over and we do the same thing for the downswing. Do we have any mobility issues limiting us in the downswing? Sit up nice and tall. I'd have my plane here, and I check internal rotation through that lower half and external rotation through that lower half. Where might the mobility issues lie? There's even some stability or strength assessment happening here, where maybe we get you on the table and you have adequate hip range of motion, but standing up, all of a sudden something changes. This tells us we need to work on your motor control, some strength stability stuff through there to get you using all of your mobility in this golf position, standing upright version of it. Now, something we also might look at is the pelvic rotation test. So this is another TPI test that's, again, just assessing for our ability to actually rotate our pelvis relative to the trunk. For this test, I want you to be standing up like you're holding a 5-iron or a 6-iron. And you can just place your hands on your shoulders like this. And I want to see you rotate at the pelvis without swaying too much side to side and without pushing one knee back and forward like this. Again, we need our pelvis to rotate while our head and trunk stay oriented down. So if we see that the trunk's coming along for the ride a little bit, or if we see we just kind of don't understand how to do it, then we know we need to work on our motor control at the pelvis. It may be that there's a mobility issue down there as well, but we definitely know we don't quite understand how to get that pelvis rotating independently from the trunk. So that's the pelvic rotation test. It's important, or a nice supplemental test to our lower quarter rotation test to help better understand what's going on there. Another test we can do to assess whether our glutes are doing their job in creating the stability and the control that needs to happen at the pelvis is this glute extension test, another TPI test, where we're just going to have you extend towards the ceiling here. We want your hips as high as you can get them. We want to make sure that your tibias or your lower legs are kind of pointing straight up towards the ceiling through there. And then we're just going to extend one leg, matching the thigh angle. And we're looking to see if one side starts to dip down. We're also looking to see if you can hold this position without compensation for 10 seconds, without your hamstring cramping, your low back lighting up in discomfort or tightness. And we want to make sure that you're getting a glute contraction. Just check. Do we feel our glute participating heavily to do that glute extension test? Or is it mostly hamstrings doing the work? Or the low back is starting to light up? Then we know we need to work on our ability to actually control or turn on our glute to create control at the pelvis. If we're using other muscles besides the glute to control and create hip extension and other things happening at the pelvis, then we're going to really struggle to do that pelvic rotation, pelvic tilt, and other tests that we need to create an efficient kinematic sequence. So what if I don't pass the lower quarter rotation test? Then we know we need to take a closer look at all the joints involved in creating that motion, again, lower half, to see where the restriction or restrictions that are keeping you from accessing full rotation in your backswing or your downswing. So we do these tests on both legs. What we want to know is, first, hip internal and external rotation. Now, depending on which side you failed, you can kind of fast track this and you just look at the pertinent ones, but we'll just take a look at all. The way you can test this for hip internal rotation is we want this hip directly over, this knee directly over my hip. From here, keeping that position, I'm going to push my foot out towards the side. I want this angle to be 30 degrees. We expect to get at least 30 degrees of internal rotation from each hip. Now, if I'm not getting to 30 degrees, and you can use some video recording to help tell you where you're at, or have a friend help measure it for you, then we could also assess the same thing on the other hip, 30 degrees. See, does one side feel a little bit more stiff than the other? Are both less than 30 degrees, or is it just one of them? We also want to know external rotation. To assess that same thing, but now this foot's coming towards the midline as my femur externally rotates. I'm looking for 45 degrees of external rotation here. Same thing on the other side. I want to know, do we have 45 degrees of external rotation? This is where we can start to see, is there mobility issues happening at the hip joints for internal or external rotation? What we also want to assess for here is tibial internal and external rotation. Again, the lower leg here needs to be able to rotate at the knee joint. It's not much, but it needs to happen. It also needs to be able to rotate down here at the ankle. So what we do for this test is we make sure that this knee doesn't move, can't move from side to side. We keep it straight, and I just want you to slide your foot out towards the side. Again, this knee is not allowed to come out for the ride. This knee has to stay perfectly over the center of the ankle. We're just rotating what is the tibia there. Same thing, I want to do it for internal rotation. Can we get this toe towards the midline? Make sure that when we do this, as we slide our foot in, we keep the inside edge of our foot down, or at least when we finish, we need to make sure that that inside edge of the foot goes down. What we're looking for here is 20 degrees of internal rotation, where we slide the toes in, and at least 20 degrees of external rotation. What you find is most people don't struggle at all to get that external rotation. They usually have plenty, but this internal rotation can be quite limited on a few people. Think of the downswing and that lead side leg. You need to be able to rotate through and stabilize through that kind of posting up through that lead side leg. If you're not able to create internal rotation, which is basically in this case your body rotating on top of the stable leg, then it's going to have to happen somewhere else. And this is where we get some pain and injury coming up the chain. Lower extremity restrictions causing things like low back pain. Okay, same thing with that backside leg. We need to be able to coil up into that backside and pivot. If we can't create or a shift and turn ourselves on top of the stable lower extremity and create internal rotation there, then it's going to happen from somewhere else, or we just won't get it and we won't be able to achieve those positions we need to achieve. So lower quarter rotation test, this is how we look to see, do we have adequate joint mobility at the different joints that are involved there. The last thing we might want to look at is our ability to supinate and pronate the foot. So what that means is, can we plant our foot into the ground and almost turn the sole of our foot outside or outwards? And then can we do the exact opposite and pull the sole of our foot towards the inside and kind of show that? So if we're doing it in both feet here, we can see how we're getting the feet, the midline of the foot to kind of drop down and open up the outside of the foot, then do the exact opposite. Now we really want to do this with minimal action here at the knee, because we could just simply orient ourselves into what mimics pronation and supination, but we don't want that. We want to come in purely from the foot. So this is what it should look like. The same thing here. On this side, and on me, a little bit more difficult to get good pronation. I do a pretty good job of supination, but pronation, this angle here, a little bit more difficult. Supination, a little bit more easy. Here I do fine with pronation and supination. So that would be something to look at. When do we need pronation? Pronation would be helping to push us into that backswing. Or if I'm doing the lower quarter rotation test, pronation is going to be needed when I do external rotation of this lead side leg. So another thing to look at, pronation and supination at the foot. So how can we start addressing some of these mobility or strength and stability limitations? Well, let's start at the foot. A lot of hands-on work could be great at opening up space at the foot and ankle, so we can start working on our ability to create supination and pronation and tibial internal and external rotation. Again, chiropractic adjustments through the different bones of the foot could be really helpful, distraction of those joints, as well as some banded means of getting in there and creating distraction at those joints where we can get some tension. This one you need a friend for, or again, a clinician to do it for you, where we get a ton of tension on that band through there, and then we just dorsiflex and plantar flex that foot. There's a lot of great drills that we can do for that to help open that up. Now, when it comes to more of the stability to the motor control stuff, and we can still get some good mobility stuff in there too, there's a few interesting drills we can do. One with a little block here, or a ramp, is I want you to stand on the edge of like a 10-degree ramp, nothing too crazy. Inside edge of the foot needs to stay down. So I want your big toe side on the high side of the ramp. And the ramp, again, should be at about midfoot to a little bit further out. So we're not fully stepping on the ramp. We're not just toes on the ramp. I want somewhere in the midfoot to somewhere between midfoot, forefoot. From here, we're just going to hang out, hold this position. We can use a PVC pipe to help give stability. We can hold on to a wall, whatever we need to do. All we're doing is holding this position without letting our heel come off the ground, or sorry, touch the ground. We want it to be at about level with the foot. We're just holding it here. The key is to keep that weight on the inside edge of your foot as you do this. Pronation, pronation, inside edge of that foot. In my case, I would want to do it more on my left foot, right? And so what this is doing is it's forcing us, otherwise we'd kind of fall, or this inside edge would come off of the ramp there, because the weight is trying to push us towards that outside edge. So we're using that ramp to help force us to push our weight onto that inside edge so we can balance and keep our full foot onto that ramp, okay? All we do is just hang out there, to spend some time there. We can progress this into doing a split squat in this position. So now we're generating and creating force in that pronated position. It's exactly what we want to learn to be able to do. We're getting comfortable in that pronated or internally rotated foot. Split squat here, coming up and down like an elevator, but again, on this ramp, making sure that we're maintaining inside edge of the foot pressure into that ramp. Okay, when it comes to the tibia, or when it comes to this tibial internal and external rotation, there's a lot of things, good things that we can do, a lot of hands-on techniques, but I want to show you one drill in particular where we are working on the ability to create femoral external rotation on an internally rotating tibia. So it's a fantastic drill or exercise to start reintroducing these specific relative motions at the knee joint. So what we're doing is we're starting on a bench. We do it on the floor, quadruped position. What we want to do is think about pulling your toes together and getting your heels as far away from each other as you can. So your toes touch, and then drop your heels as far away from each other as you can. From here, we're simply going to rock back, but we're going to maintain that heel away from each other pressure or force. So we're actively trying to push our heels away from each other as we sit back, 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 back onto our heels. That is creating external rotation at the femur as our tibias are trying to internally rotate on top. The way we can progress this, pick one leg up, extend it back, keep that same position, and we're just going to rock back. Now you might feel your hip flexors and your quads light up a little bit to control this motion. Sit back onto it and then extend back out of it. You'll get some quad, you'll get some glute. It'll be good. You're going to feel your tibia and your femur rotating on top of each other. Again, creating that relative motion where they're doing the opposite things like they should be as that knee flexes. Okay, for this next drill, what we're trying to do is create or change the orientation of the pelvis and then get true hip motion on a kind of neutral pelvis and rib cage. So to do this drill, what we need is a wall that we can place our feet up on. What I want you to do here is drag your feet straight down, but let the friction of your shoes or your feet keep them on the wall. This should just activate your hamstrings a little bit. You can think about driving them down. We use that hamstring activation to lift our pelvis up or peel. Think about peeling your sacrum off the floor. We don't want to go super high up, just an inch or two off the ground. Your low back should still be flat to the floor. From here, we need to work on our breathing. So the breathing sequence for this is in through the nose, out through the mouth. And when you're inhaling, it's nice and slow. Think 5 seconds. As you're exhaling, another 6 seconds out through your mouth like you're fogging a mirror. The reason why we do it like that is that helps turn on your obliques. So you'll notice when you're pushing out every last bit of air right at the very end, that last 10 to 5%, when you're breathing out through your mouth like that, is it will shoot your obliques on, and we'll get less rectus abdominis. We don't want to crunch like this. We want to pull these ribs down and in by using our obliques to do that, and this is the best way to do it. So in through the nose, out through the mouth. We'll pull our hips back up. We're going to place a ball right here, and we're just going to breathe. Now, where we can progress this is we can start to swivel our hips. So think one hip down, one hip up, and we want to limit how much side to side motion we're getting at the hips. We don't want this. We want to just drive one hip down, one hip up, and then exact opposite. Maintaining this peeled sacrum off the floor position, so hamstrings are still on a little bit. Pelvis is in a neutral position. We're tucking our rib cage down by breathing in through our nose and out through our mouth. I want you to hold some of that oblique tension as you exhale. Once you get all the way at the end and your obliques are on, hold that contraction, breathe back in through your nose, and just maintain that sequence as you swivel forward and back. Think about pushing this knee as high as you can, driving this knee as deep as you can into that hip, and then doing the exact opposite. A key here is that your feet have to stay flat to the wall the whole time. Can't let a heel pop up or your toes start to pop up, anything like that. Then we're getting not motion at the hips. It'll come in from the foot instead, right? So that has to stay firmly planted on the wall, and then we're just swiveling through there, getting good true hip motion on a neutral pelvis. Another great way to start working into that hip capsule, I want you to stand in front of a small elevated surface. Could be a weight plate like this, could be a book. Stand 1 foot back, get a full foot contact here, but I still want all your weight on this front side foot. We're going to slowly transfer our weight, start with this leg straight, transfer the weight into this back side foot. Bend this knee as you do that as you need to. Once we get all the way to this backside foot, this front foot needs to stay flat. We should feel our hips starting to poke out of this hip a little bit. It's what we want. From here, we can intensify by kind of reaching and twisting towards this far side knee, so opposite side hand reaching. It shouldn't be too much like this. It's just a little extra by reaching here. You're going to feel that hip poke out of that hip socket there. From here, last thing, I want you to think about pushing this knee towards the midline. Not this knee towards this knee like this, just this knee. Think about pulling it towards the midline a little bit. You're going to feel big hip capsule opening here. You're going to feel a little bit of groin on that working side, and we're just going to hang out and breathe here, in through the nose, out through the mouth like we're fogging a mirror. And I want you to think, as you exhale that last 5-10%, do you feel one oblique kick on quicker or more than the other? Notice that. Notice the full foot contact into the ground. Feel that hip capsule starting to open up. Feel that groin working. This is a great way to start to integrate some muscle activation into a hip capsule opener, right? A hip mobility drill with a little bit of muscle activation to go with it. So something that we can try early on in creating or introducing hip mobility back into things is working on the joint capsule itself. And we can do this in an intense way to start things off with this banded hip mobilization. So for this one, we want the close side hip going into that band. Try to get that band as high up as you can into that groin there. Again, the higher you can, the better. From here, we're just going to crawl out a little bit until you get a ton of tension into that band. You can have a little bench here or a heavy dumbbell that you can grab to kind of help hold you there. But what we want from here, I'd say take a half step forward to keep that angle from keeping the band from going forward. From here, full foot contact, keep that foot flat. You can help your knee drive in. Again, we're keeping that foot flat. Hang out here for a second and then let it open back up. You're kind of actively turning that glute on a little bit to do it, and then pull it back in, keeping that foot flat. Do that for 8 to 10 reps. You can start to work up even more if you'd like. Get a heavier band or just move further away from it. And what that'll do is it starts to get that hip joint moving in that hip capsule again. So you get to affect the passive tissue of that hip capsule, the non-contractile tissue, by doing a drill like this where we force things and kind of push into that hip capsule, open it up a little bit, get some proprioception and feedback into that hip joint, and you'll be surprised at how things can just open right up. Okay, to build some strength into our mobility, what we want to do here is a bent over split squat with a little bit of pelvic turn. So if I'm working on this left side leg, I can use something like a rack to help support me. What we want is full foot contact here. This backside leg kicks out. Get it pretty far onto your back toes there. The key positioning here is I want us to be hinged over to start. A big hinge, a bent over split squat. So what that looks like from here is I'm here. This is kind of a normal split squat position. I want us hinged over that front foot. Your sternum stays over your foot as we do this drill. So from this hinged over or bent over position, we got a slight bend in the knee. Now we're just going to twist into that lead side leg. So just a little pelvic twist. What happens here isn't important. We want it to be pelvis. So just a little pelvic twist, and we're hinged over. From here, we're going to maintain that position as we do a split squat. We can limit the range here. We don't need to get full knee extension because that'll probably bring us upright again. So just go as far, try to get that knee down to the ground, keep that pelvis turned in, and the moment we feel like we run out of space there, we just stop and we go right back down. Okay? So sternum stays over foot. We can load this, if we do load it, opposite side arm. So if the working leg is the left leg, I want to have the weight in my right leg, or sorry, my right arm. From here, squatting down, back up, stopping there, and back down. Maintaining that pelvic turn the whole time through. This is getting us deep into that hip internal rotation. We're keeping it there, and then we're getting strong into it. So we're going to help open up some more space, and then again, integrate that space into our actual motor control, our motor patterns. We feel strong and confident at that end range. Okay, so if we have access to a 3D band or 3D strap, this is another great way to start integrating lower extremity strength, stability, and mobility with upper extremity mobility and strength. So what we'll do is we'll use either a cable machine, or you can attach this to a band that's attached to a strong anchor point. We're going to go around our back with the band, step out, we're going to rotate into it, and then from here, whichever leg is closest to our anchor point is going to be forward. We're in this kind of bent over split squat position again. From here, your weight needs to stay over that front foot. Don't let yourself come up. From here, we're reaching, allowing us to rotate back towards what we'll call home base. And then again, without leaning from side to side, we're going to rotate out of it. And then we're going to keep going, going, going. As I'm in this position here, I'm pronating out of this foot. I'm internally rotating into this foot, and I'm creating a little bit of glute activation to pull me into my downswing, push me into my downswing. From here, I'm internally rotating into this hip, into that tibia, supinating the foot. To avoid going too far, what I'm going to end up doing is pronating against that. So now we have a pronated foot, internally rotated tibia and hip, and then I push, 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 push out of that. I will allow my foot to supinate to allow myself to start coming back up, up, up. And then to translate or transfer out of that, I supinate that foot back down. Internally, I start externally rotating things into rotation. So we're integrating foot mechanics, feel from the ground, and how we develop power from the ground up and strength from the ground up into rotation, while integrating our trunk rotation, our hip rotation, tibia, knee, and ankle, and everything up and down the chain. Okay, to start integrating power into our new mobility and our new strength, through that mobility in the lower extremity, we're going to use a little kettlebell circuit here. So there's a few different exercises I'm going to show you all at once. All great progressions to start, again, integrating speed, dynamic, and power into our new characteristics. So first thing I want to do is not a normal kettlebell swing here like this, but a side-to-side kettlebell swing, working in the frontal and transverse plane, right, which is what the golf swing mainly takes place in. So for this, let's just do a side-to-side kettlebell swing. I want you to feel what's happening at the foot. Do we feel the one foot pronate and then supinate, the other foot pronate and then supinate as we swing side to side? Do you feel your hips loading up and then pushing out of that position? You feel your trunk and T-spine definitely rotating on this axis as you stay bent over in that golf position as you rotate. A great drill for starting to integrate speed and dynamics into this new mobility. Another great way is going 1 foot forward, 1 foot back. We're going to keep this kettlebell off to the side. So if I'm working the left side here, I'm doing a kettlebell swing, but now I'm off to the side. What's happening here is as I catch, I'm loading dynamically into this left leg and then being strong to come out of that dynamic position there, right? So we're doing it under speed and heavy load, where again, think about our split squat position where we stay internally rotated here. It's the same thing, but now it's with a dynamic force, something that's coming in with power and speed. And we need to be able to accept that force, have the mobility to do it, the strength to do it, and then push back out of it with strength and speed. We do the same thing with that other side leg. Another great progression. Start light, work your way up. Do it for time, 30 to 40 seconds, or you can do it for reps. Another great progression here that I really like is single leg again, but now we're going to go side to side again. You're going to feel how your foot has to balance pronate and supinate. You're gonna feel your tibia internally rotating, and you're definitely going to feel this hip start to light up. The position here is we keep this knee bent. Again, we're hinged over a little bit, and we are rotating through here like this. Now, it's going to take some time to get good at it, to figure out how to counterbalance as you move. But once you get better and better at it, we can increase the weight. We can increase the time you're doing that. And again, the stability that you need through that lower extremity, it's very high. So again, this foot needs to be able to accept into supination, pronation. There's no room for this foot to come off the ground anymore. So it has to stay flat, which means we're getting great relative motion at every single joint up that chain. It's a great drill. Do it for 30 seconds, start light. You're going to see how this hip has to internally and externally rotate as I come around.
that foot pronating in my shoe, is supinating in my shoe, the tibia internally and externally rotating. Again, it's a great drill. It's one of my favorites for building in that relative motion through every single joint while being strong and powerful to do it. Again, you can really work into this and give it some heavy, big throws as you do that, as you get better at it. Okay, how can we really start integrating what we've done so far into the golf swing? Well, we can still do that with some exercise, some tools like a medicine ball and some bands. So first thing we want to do is we can try this foot on wall med ball slam. What we want to do is rotate towards this standing side leg, build up some steam, come back through here, and then we're throwing straight down. What you should feel is you got to maintain this full foot contact through here. You're going to get some glute extension, get some hip, some glute working. This lead side leg, as we build up here, we come back, we have a slight bend in this knee, and then we chest pass that ball down, right? So we're not coming over the top and slamming it. We're throwing it like this. And as you do that, this leg needs to fully extend. We're pushing ourselves into some internal rotation through here. Again, we're getting this glute to work a little bit to do that, into some extension. You're going to feel that hip light up, this glute light up, and maintain full foot contact, full foot contact. As we do that, what we're doing is we're creating force through the ground, force in this transverse rotational plane without emphasizing an early extension position. So this is where we get some golf-specific positioning. Again, by keeping this foot up and this foot flat, is we prevent ourselves from being able to do this. We'll come off the wall. So we want to push this foot into the wall and then use that as a counter to, boom, pushing those hips back. So now we're able to extend and rotate without standing upright. Okay, so really important for kind of integrating some of our lower extremity work we've done into creating power without compensating with poor swing mechanics. We can also start integrating what we've done here in the clinic and the gym into the swing while staying here at the clinic gym is by doing this banded knees to center drill. So I want you to get into your backswing position, holding a band behind you like this. From here, we get a full pelvic turn, full trunk turn, full shoulder turn, a really dramatic turn. From here, I want us to start the downswing with our hips, right? So knees come to center. That's what we want. This is, again, us rotating our pelvis, starting the downswing with our pelvis and lower extremity, and then we can bring the trunk along for the ride, right? So knees to center, everything else. Come back here, knees to center, everything else, okay? So again, when we're doing that swing at the very end, we want to make sure we're not emphasizing kind of an over-the-top swing. So if this is coming through and getting you at your neck, you know that you've kind of hiked up too much. So we can go knees to center without compensating or overcompensating. We know we do a good job and we stay in this position to maintain our posture as if when we come down, that isn't chopping our head off through here. Okay, so we get a couple ways of getting feedback through this drill. Again, the emphasis or most important part of this is just starting to work on using our new mobility and our new strength and stability in our lower extremity to create that separation from pelvis to trunk. Okay, so we've done the lower quarter rotation test. We've worked on mobility, strength, stability, power production, integrating our strength, stability, and power into the swing, all in the clinic and in the gym. How can we go about doing it on the golf course now on the range? How can we take it that last step? The last step to improving our lower quarter rotation test and making sure it's transferring the best we can on the golf course is by doing a couple of swing drills. Something we can do on the range, 5, 10 swings with a couple of these drills, go back to hitting, working on whatever it is you're working on, maybe go through again, do them again, and then you're off to the races. So something that we help to emphasize the transfer from the clinic and the gym into and onto the golf course is, for lower extremity, is this lift, lead, heel drill. So our lead heel is up off the ground. We go into our backswing. As we come down into our downswing, we stomp that heel as we come through. What that does is that really emphasizes us posting up and creating internal rotation and getting comfortable shifting and then creating power into that hip. That's what that lift, lead, heel drill will do for us, okay? And it helps us maintain some of our posture as we do that. So again, just to help integrate all this good new mobility that we've worked on into our hips and our lower extremity, is we can do this drill so you feel it, and you know, it just kind of gives you cues to use all of that new stuff that you've built. So now you feel what it's like to actually use it. Another great drill here is where we're just going to lift this backside leg, and we're just going to take swings with a single leg. you have no choice but to create and use all that mobility that we've done in our lower extremity when we swing like this. We can do the same thing for our backside leg. Same exact thing. You have to use all that mobility that we've built up, all that strength to be strong and to get into those end ranges, and all that strength and power to use that to create a quick, explosive swing. Now, you shouldn't be swinging as hard as you can here, but swing hard. Make sure that you're using all of that mobility and strength and power that we've built up so that you can feel what it's like to actually integrate that into the kinematic sequence and your golf swing. At this point now, we have the best chances of working with a golf professional who can, again, give you even more precise, specific cues and swing lessons to make sure that that kinematic sequence is actually happening and we have the most efficient and productive swing that you can actually have.
So to wrap things up, the lower quarter rotation test is a very helpful test to do to get a better understanding of what is happening at the lower half of your body, the lower quarter of your body regarding limitations, strength, and motor control. From there, we know that we need to or don't need to take a closer look. And if we do need to take a closer look, we can emphasize the hips, motor control at the pelvis, mobility at the knees and ankles, and then from there, integrating everything that we need to do back up the chain, starting with mobility, then building strength through the mobility, putting some power behind these new mobility options that you have, integrating that power into the swing, and then finally integrating the swing into your new body. From there, give it to a PGA professional to work on the nitty-gritties, but at least they have a blank canvas, which is you, to work with when they know if they need to make a change, that you won't have a restriction or a strength deficit or a motor control understanding to actually put that change into place, right? It gives you a much better opportunity to make improvements and to get the most from your investments with your instruction. Thanks for watching. Give it a like, subscribe, and again, don't hesitate to reach out or comment if you have any questions on anything that we've done.